Welcome to the Lifespan Community Connection, brought to you by the Lifespan Community Health Institute, where we connect Rhode Islanders with a healthy future. My name is Victoria Lugo, and I'm a Community Outreach Specialist at the Lifespan Community Health Institute. Today, I have the pleasure of introducing and bringing to you Dr. Yovanska Duarte Velez. She is originally from Puerto Rico. She now lives and works in Rhode Island. Welcome, welcome.
Thank you. It's a pleasure for me to be here.
Thank you. We're very happy that you're joining us today. Dr. Duarte Velez is an investigator at the Lifespan Bradley Hospital. She also is faculty at Brown University. She also has a clinic where she sees patients called Mi Gente. Doctor, would you like to tell us a little more about Mi Gente?
Well, Mi Gente is a program for youth from 12 to 21 that delivers care, therapy, counseling for those that have mood disorders or feeling really deeply sad from the Latino community and that have experienced trauma or that have had suicidal thoughts, behavior, any suicidal crisis. So we see those youth from 12 to 21. Yes.
Thank you.
And their family too.
And their families too, right? It's a family affair. Dr. Duarte Velez, when you're seeing your patients in the office and you're speaking to them and their families, how do you describe mental health?
Yes, so mental health for me, I will start first defining what mental health is the ability that we have to manage or cope with our thoughts, our behaviors, our thoughts, I said thought already, our emotions and feelings, right? So the ability that we have to do all that in a healthy way. So if we are managing all of that in a healthy way, which means that is doing good for myself and for others, we are in a good mental health. If we don't, and we don't know how to manage all of those, then our mental health maybe is not that great. So I compare that with our physical health, right? Sometimes we have a great physical health, and sometimes we don't. So it's vary from one time to the other, depending on the circumstance that we're living. So that's how I describe.
Doctor, do you think that the topic of mental health in the Latin community is still very, stigmatized and like taboo?
I think so. I think it is still a topic that is hard to discuss in families, is dismissed a lot because a lot of Latina families have this idea that going to a psychologist or counseling is for crazy. And when they think crazy, you have to be like acting out all over the place, like kind of movie type of thing. When it's not, right? And some people does not even, they say, I don't believe about mental health. But we all have mental health, as we discussed already, as we all have physical health, right? It's part of us. We are human beings and we have emotions and thoughts and all that. But there's still a lot of stigma around. For example, sometimes there's not just a lot of stigma, but there are ideas in our community kind of that dismiss going to talk to someone else, a professional.
Doctor, given, these barriers and that there still is a stigma in the Latino community, do you know or can you share any resources that are available presently and currently for folks to, utilize?
Yes, there's a few. I already talked about Mi Gente program. We focus on youth, and their families, but the center is the youth, take care of the mental health of the youth, of what I said, like when they feel sad, trauma, or thoughts about wanting to die. We also have a study right now for youth from 12 to 18 that you will be able to read more about that in the website. And that's for youth. But for adults, Lifespan have the Latina Clinic, and that's for adults from 18 and older. Okay. And they have bilingual clinicians there too, as us in Mi Gente, we have bilingual clinicians. That's for mental health, right? There's a lot of other resources in the community that people can search, but at least in Lifespan we have those two. And then in the community we have Progreso Latino, which is a community organization that have served the community in many ways. It's not mental health, but it's a there's a lot of support that is provided, classes for English, and so many resources that they have. And the worst scenario, right? We have 9AA. Everyone could access 9AA if there's a mental health crisis, an emotional crisis, and they don't know what to do. That will be my best suggestion, to call 9AA, which is 24/7. And they can provide someone that speaks Spanish as well. So those are kind of the main that I'm proposing, but there's a lot more in the community, of course.
I know for me, I mentioned, I journal, I like to read, and it doesn't have to be like a book and I'm sitting reading a book. It's just like I'm walking down the street and I'll read anything. It's just taking that little bit of time for myself. Do you have any other suggestions, Doctor?
Yeah, I mean, myself, I love to listen to music while I cook, and that little time to spend time with myself and enjoy what I am doing is very important. Like, be mindful of what you're doing at the moment. But it could be anything. It could be in nature. It could be a walk. It could be walking the dog, right? If you have a dog. It could be going to the park and be close to nature. Just watching the sea. We are in the Rhode Island, right? Everyone can see the sea. And there's other many ways. I think every person could find out what gives them some peace and what helped them, like, calm their thoughts and their emotions in a way that they can then approach problems in a better way. But there's a lot of things that could be done. Could be even play cards with their kids or with their partner, or it could be anything like that. A gathering with friends and family could be very helpful too, depending on the situation.
Yeah, Doctor, this conversation was great. I think we're going to need to continue the conversation. I hope that this conversation was able to, open folks' eyes out in the community and give them the empowerment to have these conversations and, step up and take care of their mental health for themselves.
Me too. Thank you so much.
Thank you, Doctor. It was great having you with us here today. We hope that this episode of the Lifespan Community Connection has connected you to a healthier future. Thank you for watching.